George. Here we go. Happy to introduce Carrie Caulfield, who is going to be the faculty facilitator for this and facilitating through the presentations and the Q&A sessions. Carrie is the Director of Pre-Service Training at the Boggs Center on Developmental Disabilities at Rutgers University and is one of the collaborating research entities within the AIR-P project. Carrie, thank you so much for being here and for serving in this role. And I'm happy to forward slides throughout, so folks can just tell me when to switch to the next slide.
Thank you. Thanks, Dawn. It's a pleasure to be here and I'm very excited to get to hear from our presenters today about the work that they are completing. So it's my pleasure to first introduce Dr. Jessica Kennard, who's going to briefly share about her poster titled Development and Piloting of a Remote Assessment for Hispanic Infants and Children at High Risk for Developmental Disabilities. So Dr. Kennard.
Thank you. I appreciate you all letting me have the opportunity to work with you. I put a slightly different title here, but yes, it's, we are looking at a remote assessment for Hispanic infants and toddlers at high likelihood for a developmental disability, including autism. Work that I'm completing in conjunction with colleagues at RTI International, and I am located at the Carolina Institute for Developmental Disabilities at UNC Chapel Hill. Next slide, please. So we are looking at remote assessments for the Hispanic population because we know that there are delays in getting an autism diagnosis and barriers to receiving that diagnosis. I've listed some possible barriers here, and remote assessments have been proposed as a possible way of reducing at least some of these barriers. Next slide, please. The remote assessment that we are evaluating for this project is called the Panda Box, the Parent Assisted Neurodevelopmental Assessment. This was developed for English-speaking families by Dr. Kelleher and colleagues at Purdue University. And you see pictured here the kit of materials we mailed to the families to complete the assessment. Next slide, please. This project is done in two parts. We have two pilot studies that are very similar. So the first pilot study, for the past year, we've been working on translating and adapting the Panda Box protocol to use with Spanish-speaking families. And we are recruiting families who have infant siblings of children already diagnosed with autism. And then we are trying out the Panda Box with these families and getting their feedback about how it's working for them. Next slide, please. So for the process of translating, we've done we translated the protocol and did a number of different interviews with Spanish-speaking families and professionals, revised many times to get a rigorous translation. Next slide, please. So we're now currently trying out the Panda Box with 3 to 24-month-old infant siblings of children with autism. They get an audio recording. We go through the Panda Box activities with them. We do assessments to validate the Panda Box results, and we interview the families to get their perspective on the whole experience. Next slide, please. And so our second pilot study is being funded by the AIR-P project. We're doing the same protocol, except this time we are trying out the Panda Box with Hispanic families who are identified in the community as they're filling out a screener and their infant is identified as showing elevated likelihood for autism. And then we'll compare the two groups of kids, community screening versus younger siblings, to see how the results compare. Next slide, please. And that is our project. Happy to take questions during the questions section.
Okay. So thank you so much for the work that you're doing and for sharing this exciting work. I think we can all appreciate how timely and really important both the sort of remote assessment is, but also the appropriate cultural adaptation of the Panda Box itself really is. And so I guess just to kick off the questions, what kind of feedback are you getting from families? How are they finding the experience, particularly of the remote assessment and the sort of acceptability of that as a process?
We're currently collecting the data, so we don't have concrete results to give you, but anecdotally I can say so far with the families who have an older child with autism, we're noticing some difficulty managing the older child at home while also completing the assessment. So we can hear in the background needing to divide your attention between your child who needs specific attention and then the infant where you're completing the activities. On the other hand, though, we're getting feedback from families that they're very eager to get this assessment. They do have concerns about their infant. Maybe they have even 2 older siblings diagnosed with autism, and now their baby's the 3rd that they're concerned about, and very open and excited to be part of this process. So I see challenges and I also see positive feedback.
Sure, and I look forward to hearing more about your results as you continue to collect the data. We're having some questions put in the chat, so I would like to encourage everyone to add your questions to the chat or to feel free to unmute yourself and ask your questions. But folks have asked if you could describe a little bit more about the Panda Box assessment itself.
Mm-hmm. Yes, and I also see a question about the Lena recording in there too. So what happens is the day before the Panda Box assessment, they get an audio recording device called the Lena. I believe that stands for Language Environmental Analysis. So for those of you who are unfamiliar with that, it's a little audio recorder that the child wears on a vest on their chest. You press record, just let it run continuously during the natural activities of the day, and the software can provide automatic analyses of the communication environment, so back and forth turn taking between adult and child and so forth. So we have that the day before, and then the day of the Panda Box, our assessor calls the family, walks them through how to set up all of the technology. Then they're observing the family over a webcam. We mail them everything, including the computer with the webcam. And the activities all last in total about 45 minutes. And they are free play with some toys where the child is just playing with the toys. We're seeing some play skills, motor skills. There's parent-child free play to see that interaction. There's an attention task where we have the child watching a Baby Einstein video, and we can track how many times they're focusing or looking away from the screen. There's a temperament task where we're doing some activities that are slightly frustrating for the baby. They're meant to be mildly frustrating to see how the child responds, like holding back their hands to keep them from taking something that they may want. There's a storybook reading to see that interaction with a wordless picture book. Those are the, and then we have autism presses where we are having the parent call the child's name and things like that to look for signs of autism. So those are the main components. And one other thing as part of those autism presses that has come up is peekaboo. We're looking at social interactions, and during our adaptation process, peekaboo came up as something that wasn't culturally relevant for many Hispanic families. So we've been thinking through how to adapt that, whether to explain it in more detail or just to provide an alternate activity that may be more familiar in the culture. And I see a question about the validation of the assessment tool. So we have a number of parent questionnaires in Spanish to try to get at some of those similar domains. So for example, the Vineland. And we also are doing an observational assessment with the child as well to try to get clinician observation of skills that would match what we're collecting in the Panda Box. And the language sample, yes, the Lena can analyze the audio sample that we're getting, computer analyzed, but we also have the option of going in and listening to the audio clips manually and coding for different behaviors in the audio. I see a question about, do you have any ethical concerns about injuring the parent-child trust by forcing intentional frustration? The mother, as the primary caregiver, needs to be the safe space for them. I'd worry this would disturb the parental trust. That's a great question, and that's something that came up in the interviews beforehand. Some parents asking, do we need to do that temperament press? Is it something that could maybe be saved for the end? It's 30 seconds, and it has been trialed with populations in English, children with autism, children with Down syndrome, Fragile X syndrome, and has worked fairly well. It's 30 seconds of gently holding the child's hand followed by bubbles. So the bubbles are meant to kind of restore that feeling of trust. And we have a script for the parent to say where they are going, it's okay, we're just playing. But that's a great question. And of course, we always tell the families, this is a research study. If there's anything you don't feel comfortable with, you do not have to do this. And just let us know, because the point of the study is to find out what you feel is acceptable, what you think is feasible for you and your family. And if you feel like something isn't, then please tell us, and that will be part of our feedback. That will be helpful.
I guess just another process-related question. As you're administering or talking to parents through administering some of these tasks, is there feedback or an evaluation provided right away, or do you take time to sort of review everything collectively? So how does it work timing-wise for the family?
For the families to give their feedback. So we are telling them that they're going to have, so they have an hour-long qualitative interview with a native Spanish speaker, and we try to schedule that within a week after they have gotten the assessment, so it's still fresh in their head, but we also don't want to overwhelm them, so it doesn't have to be, the next day or something like that. So just whenever the family feels comfortable in the next week to have that interview. And we've obviously when they're signing the consent form, and then during the assessment, we're reminding them, we're doing this to get your feedback. If there's anything you're noticing that you want to remember to tell us, you can tell us now, or we'll talk with you later this week. I see in the comments, the parents may not have full comprehension of the implications of what's being asked. They may not feel they have the power to refuse. And that's a really great point, especially if you have that feeling of power dynamic where there's an authority figure and there's a cultural feeling that, oh, I can't say no. So when we've been working on these adaptations and translations, we've gotten a lot of feedback from the Hispanic community to put these disclaimers throughout in the beginning of every single activity, explaining how they are in control and how they're doing us a favor, and how this is a research project and we're trying to make this better for families, trying to help them understand as much as possible that their feedback is what we're looking for more than their child actually completing every single activity. More important to know what they're thinking than actually getting through every checkbox.
There's one more question in the chat about next steps for kids who test positive.
Yes, so for all of the families in our study, we are providing, so we have, I'm a speech language pathologist, we have a psychologist on the team, we review each case and provide a report with feedback for next steps, whether that's continued monitoring the services they already have in place, or if we feel it's warranted to refer to a specialty clinic. So we help guide them through those next steps.
Okay. Any final questions for Dr. Kennard? I don't see or hear any. Thank you so much. I think this is such an exciting line of inquiry, and we're really looking forward to hearing fuller results as they are available.
Thank you. I appreciate the time and all of your feedback.
Okay, and so now it is my pleasure to welcome Dr. Denise Nunez, who's going to share with us her work, The Impact of COVID-19 on Families of Children with Neurodevelopmental Disabilities. So welcome, Dr. Nunez.
Hello, everyone. My pleasure to talk about some of the work that we developed from our study. So our study was basically an evaluation of the impact of the global pandemic on our families of children with developmental disabilities. It was focused more on children and families in the greater Los Angeles area and the neighboring regions. And this group is already particularly vulnerable to a lot of issues prior to the pandemic. And as this national issue and international issue occurred, one of the biggest concerns that we had was the impact on services, therapies, and supports. And these children, as you all probably know, highly depend on these services to reach their physical and intellectual capabilities and their highest potential. And to remove these or have any interruption in these can ultimately lead to a crisis that can lead to impacts throughout their life. So in our study, next slide, we wanted to look at these impacts through a survey. So we have a prospective cohort study of pediatric patients and their families. You can go, okay, here in the next slide. Thank you. I have a little delay on my end, I think. By providing a survey to those families who had at least one child with a diagnosis or suspected diagnosis of neurodevelopmental disability or special needs. And those that opted in received a survey with questions about their general demographics, changes in their service access, and then family scales that were validated questionnaires to get a sense of the family environment and how that might play into some of these issues. In addition to exploring some of the COVID-19 behaviors and impacts that occurred with their family during the time. And the first leg of our survey was given from November 2020 to February 2021, which was during the peak of the pandemic. So it was an interesting time. And the second round, we are currently in process of distributing and gathering information. Next slide. So this is just a table of the demographics, and I'll just highlight due to time some of the points to take home. So most of our families were parents, the ones who filled out the survey, and they were mainly white in their race. And we also had 34% Hispanic representation among other races. Our families tended to have associate's degree or higher, and most of our families were married. Next slide. So for the children, most of the children's diagnoses to highlight here are autism spectrum disorder, which was about 42%, and then ADHD and ADD were the other higher diagnoses, which is 37%. Most of our children were receiving classes remotely, not surprisingly, 76% of them. And for school-based services, most of them were receiving speech and language. Next slide. So this is a summary of some of the impacts of COVID-19. Most of our families experienced mental health issues, child behavioral difficulties, and physical health issues. We also asked questions about their potential of allowing their family to receive a vaccine, and this was prior to vaccine availability. And so a lot of our families were considering it. And then we asked about emergency preparedness plan and modifications due to the pandemic, inclusion of pandemic-related changes. And so the information is listed here. Next slide. And so something that we looked into a little further was to see if anything could predict that families have a more difficult time or less difficult time, because it was difficult for everyone. And so some of our preliminary findings is that it appears some families that are in relationships, whether married or separated, seem to have more difficulty than families who are single, which was interesting. For those who are working from home, it did not appear to help as we hoped in the family situation. And then household income appeared to have an effect, with those making more income having less difficulties than those who had lower income. Next slide. And then for the family environment and the validated scales, we found some interesting preliminary findings that families that selected statements such as, my family has shared beliefs, we go to church, which is more religious, tended to have less difficulties than those who had difficulties, along with those families who said they were more organized and allowed expressiveness in their family, seemed to have less difficulties when compared to those who had more difficulties. And so that's pretty much a summary of some of the interesting findings. Thank you. Glad to have some more questions because we did have a lot of information to share, but you know, it's a rapid fire. Thank you.
Thank you so much. Again, I think this is really interesting and important work, and I'm curious what you think sort of the important implications of this work are for all of us and for your practice.
Yes, absolutely. That's a great question. Holistically speaking, we were looking for things that could help families to prepare for the future. Hopefully there's not other waves or not other crises, but we definitely want our families to prepare. We expected that COVID-19 would affect families in such a way. And so the survey results definitely supported families having trouble. And with the major individuals filling out the survey being educated, having economic resources, being married, these groups still had difficulties. So for those who were able to fill in some gaps, get some private services, they were still struggling significantly. So if that is how this population was doing, we can only imagine for those who didn't have the time, the bandwidth, or the capacity to answer these questions, what they were going through. And that was one of the major issues we had. We really tried hard to get a more vast representation, especially for families that were in a more vulnerable group. And we had a little bit of presence, but not as much as we'd hope. And so it's just knowing that everyone's having trouble, regardless of what level of resources they have. And it's important to have these conversations during this period and moving forward to help families prepare, know what resources are out there, and know what structure within their family can actually be strengthened to provide less issues with these matters.
I really appreciate that.
No problem. Yes,
thank you
for the question.
So yeah, there's a couple of questions in the chat. First, someone asked if you can explain more about what expressiveness means as you.
Yes. Absolutely, yes. So this was from the family environment scale, and expressiveness was described as the ability to communicate openly. So in that particular survey, the questions were statements that describe the family. My family is, for example, able to communicate when I'm stressed. My family is able to share ideas. My family looks for opportunities to discuss ideas. So expressiveness is more about the communication, the openness, and the ability to communicate, because the statements that would be the opposite is, my family doesn't have time to talk about this. My family isn't interested in discussing these issues. And so for those families that selected statements that supported communication, that was considered expressiveness, and that tended to appear to have a protective effect.
Thank you. Thank you. Someone commented, and I agreed and had written down that it was really the interesting finding about being in a relationship versus being single, and how that was slightly more difficult for families to kind of navigate that. So just struck as interesting. Dr. Plo has said that clinically, she would say that all the findings really apply to all children, not just those with neurodevelopmental issues. And I think it will come out that family stress from the pandemic has led to the current pediatric emergency and child mental health issues. So Dr. Plo, did you want to say more?
Yeah, I mean, I didn't mean to imply that like it's at the same level for those with or without neurodevelopmental issues, but I think across the board, many of us in maternal and child health were very, very concerned about the impact of the pandemic on families, particularly with the widespread school closures for so many children, including, you know, those with neurodevelopmental disabilities. School is the regulating factor. School, you know, the daily routine of being in school, seeing your peers, and the structure is what a lot of children rely on. And so in addition to accessing services and all of that, that disruption was difficult for many, if not all children. Like some weathered it well, but the vast majority did not. So clinically, what we're seeing in pediatrics is a ton of family stress coming off of the pandemic. During the pandemic, you know, we had kids telling us, I'm sick of spending every minute of the day with my parents, you know, in front of their parents to us. So I just think that, you know, looking back on all the policies that have been made during that time, my impression the entire time was that kids were never really taken into consideration. And now with just like a week or so ago, you know, the AAP and the CDC and everybody declaring this national emergency on pediatric mental health, I think we're getting it now that, you know, like children may have been more silent about their challenges, but it's coming out now in all these mental health issues. And I think lots of people are seeing it.
Thank you so much, Alice, for sharing. Definitely something that can be extrapolated to all of our families. And I'm glad that it's unfortunate that the mental health issue has had to be highlighted in such a way, but I'm glad that it's in the forefront and being considered. And oh, yes, so sorry, we also agreed, we were surprised about the families that, you know, were single versus in relationships. My hypothesis about that is that, you know, just having to interact with another person, you know, with finances, with time, you know, especially I would imagine the divorced and separated, whether it was during the pandemic or prior, was probably taxed even further with this issue. So yeah, most of our families were married, and we were assuming that they would have a better time, but they actually had a lot of, you know, potential marital strife, relationship strife, and navigating these challenges together might have made it difficult in such a way.
And just to clarify, someone in the chat had asked who was the single person. So the parents were the respondents on the survey.
Yes.
And so the single or married or divorced referred to their own marital status as the respondent.
Exactly, that's correct. We invited anyone to fill out the survey that was associated with the child with special needs. And so they could have been mother, father, caregiver, uncle, aunt, grandparents, but really about 95%, at least 95% were parents. And if the parent was single or in a relationship, those were the ones who specified that. So it wasn't one individual that was single, it was a part of the cohort.
Yeah, thank you.
You're welcome.
Yeah, there's some interesting comments in the chat, and Dina said that her students are reporting that in their early intervention programs, nearly every child is now qualifying for some extra supports or services through EI. So wow. I think it's really reinforcing the reach of the pandemic for sure. Yeah, thanks. You know, I guess I had one other thought about this, is that it would be interesting to kind of think about doing this as like a repeated measure to see how lasting, how kind of entrenched these impacts are as, you know, some of our, I don't know, social distancing and other measures start to lift, I think the impact and what that's going to mean for young children and families, we really don't have any understanding. And so this could be an interesting opportunity to keep following your patients and asking these same questions.
Yeah, absolutely. We do have the second part of this survey, so it will be the same questions with additional questions that are clarifying, being distributed now into the end of the year. So we'll have at least 2. And then we did survey and have a discussion with the service providers. So for the doctors, the therapists, we explored really what they were experiencing, what challenges they had. So we have a couple of surveys resulting from that are still being analyzed, but it would be interesting to just continue to survey families, even those not in this cohort, but, you know, externally, to see how they've been affected. And we hope that families have been, you know, adapting and have improved, but if they haven't, you know, we're happy to hear the information. And ultimately, we provided an event where we shared some of the tools that parents felt were useful, that the providers felt were useful, and just had a discussion on, facing these challenges moving forward. And so we did that in September. And so we'll be compiling a list of resources that will be helpful moving forward for these patients, just to thank them, to give them something to work with.
That's great. That's wonderful. And thank you again for doing the work. And again, we look forward to hearing more.
Great. Thank you. Thank you for having me. And thank you for your interest in our work. We're glad to share the rest of the results as they roll in.
Sure. And so Dawn, I'm gonna look to you. I know we have our third presenter was unable to make it at the last minute. So did we have a plan to still share some of her findings?
Absolutely. Our third presenter for this breakout session did get called away unexpectedly and sends apologies. So what we thought we would do instead is to share the video that was on the Vimeo link. It's only maybe 4.5 minutes long, so it's not too much to share at all. And then if there are comments and questions that anyone here has for them, then I'm happy to take a note of those and make sure to get them to the presenter so that she still feels a part of things. So let me go ahead and share the screen and then share the video for this. And please send a note. So this is the her cover page, the impact of social determinants of health on the physical health of Latino children with autism. And the researchers are Sandra Venegas from Texas State University and also Sandy Magana of the University of Texas at Austin. And what I'll do now is just to go ahead to the next slide and share her video.
Hi, everyone. I'm Dr. Sandra Venegas, and I'm an assistant professor in the School of Social Work at Texas State University. Joining me on this project is Dr. Sandy Magana, who's a professor at the Steve Hicks School of Social Work at the University of Texas at Austin. And this project is focused on the impact of social determinants of health on the physical health of Latino children with autism. So we know that in general, there's significant research that has identified health disparities that impact Latino children with autism. These disparities begin very early on in a child's life, as we know that they're less likely to have a timely autism diagnosis. This means that Latino children with autism tend to be identified once they begin school around age 5 or 6. This means that they may miss out on that early time for early intervention or receiving early supports that would address any developmental delays. We know that they're also less likely to have a medical home. We know that medical homes can provide a lot of personalized care, and this is something that they may miss out on. We also know that they have less access to services, as well as lower levels of service utilization than white children with autism. That means that Latino children with autism may experience significant barriers to accessing services. And once they do access services, they may receive lower quality and lower quantity of services than white children with autism. Furthermore, we know that in general, Latino children may also reside in households or communities with other significant stressors, such as low socioeconomic status. For example, some recent national data suggests that approximately 50% of children reside in poor or near poor households. So this may really significantly limit the availability of services and supports in the community for these children. For this project, we were focused on examining the role of social determinants of health on the physical health of Latino children with autism. For example, we know that in general, a lot of the social determinants of health can directly impact the availability of services and supports that are available for all children and families. However, little is known how these social determinants might directly impact the physical health of Latino children with autism. For physical health, we are primarily focused on overweight, obesity, allergies, asthma, diabetes, epilepsy, and heart conditions. We explored the National Survey of Children's Health for the years 2016 and 2017 to better understand some of these, the role of some of these the social determinants of health on Latino children with autism. These preliminary results suggest that there are some differences or some factors that may impact overweight and obesity among Latino children with autism. So for example, we found that having an autism diagnosis was actually associated with lower odds of being overweight among Latino children. And this was compared to Latino children without autism. Furthermore, we see that among obesity or overweight or obesity, we did see that parents that had some college or greater education had lower odds of having children who were considered obese or overweight or obese. So this suggests that parent education may play a role in health behaviors that impact the physical health and well-being of Latino children with autism. I look forward to speaking with others and learning more about other work on physical health in children with autism. Thank you.
That was clear for everyone. And I think if there are questions, we can have the same conversation, unfortunately, without the researchers here, but I will take a note of comments and questions to make sure they go along.
So I would.
Oh, go ahead.
Oh, sorry, Alex. So I did have a question, Dawn, and I just was interested in the way, if I guess they were able to conceptualize or have indicators for all 5 of the social determinants that they talked about. So, you know, income and some of those seem fairly straightforward, but did they have any proxies for built environment and neighborhood or social context that they were able to analyze, given that it was sort of secondary data analysis?
I just wanted to make a comment that this is exactly the kind of research that needs to be done in autistic populations. More of this, you know, this poster kind of reflects what seems like an exploratory study, just sort of dipping a toe in the water, so to speak. But we need more of this. We need, you know, all different kinds of intersections with physical health, because I think one of the challenges is interventions that have been designed for non-autistic people may not work for autistic people. And one of our goals in the AIR-P network is to identify interventions that work in autistic individuals and then generalize those interventions to the general population. So almost using the autistic community to lead the way as opposed to the opposite. Right, because I do think that there's some unique characteristics to this population that can actually be a leader in a lot of this research on physical health. And I hope that comes out as we have more and more of these types of presentations and research days and publish on this in our supplement, you know, our publications and our presentations, to start allowing the other NIH institutes, for example, to look at the study of diabetes or the study of obesity in autistic populations as something that would be considered cutting edge. It's, you know, one of the things we thought about when we conceptualized the proposal for the AIR-P. And so, you know, I'm just curious what others think about that.
I think there's quite an interesting conversation going on in the chat, and I invite people to unmute if you want to share some of your thoughts. But Dina agreed that it's really hard to get funding for exploratory and policy research if not through AIR-P or AUCD or some other institutions like those. There was a question, Dawn, that you might want to make note of about the association between social determinants of health and physical health between Latino children and non-Latino children that someone was interested in. And Dina, I see that you unmuted, so I'll be quiet and let you ask.
Yeah, I just wanted to, oh my goodness, my filter's gone. I just wanted to bring up the fact that for many autistic researchers, the GRE was a huge gatekeeping issue for us. So I wound up landing at a very small university, and not a single person in the Department of Social Work has any background in autism research. And it's just been a brutal battle to be able to shift the language to identity first language. It's been difficult bringing them up to speed on the social model of disability. You know, and of course, funding is nearly non-existent. I have peers doing research at major universities who are being paid to be there, and I'm going out of pocket, you know, $30,000, $40,000 a year just to be in my program. But I don't think that's rare. It would be lovely if we could create some kind of grant resources for early researchers that are not hugely mentored within their own programs, where they could benefit from some of these major universities' expertise.
Thanks, Dina. I think that's a really, really great, and one of the things I think AIR-P is hoping to do, but certainly there's great need. Yeah, interesting. Someone else had written in the chat, Emily, she'd be curious to see the odds of obesity in the Latinx population versus non-Latinx population due to the compounding effects of stress that they might be experiencing as a result of discrimination, stigma, etc. Dr. Nunez said mental health is also so important to monitor and support, and it's affected by the social determinants of health resources. And then a couple of comments about the interesting lower incidence of being overweight, and wondering whether it might change as the children enter puberty and adolescence. So there's some interesting comments. Dr. Porter, you used an acronym I'm not familiar with, but she said, I think GIS might be useful here.
Geographical information systems. So if they overlapped census data, poverty data, that kind of thing. And then the folks who were in the study, the folks with autism, of course, you know, would be with approval type of thing, could be mapped in terms of where their neighborhood was, their access to parks, to playgrounds, how dense the neighborhood was, those kinds of things.
Cool. Okay. All right. Well, thank you, everybody, for your engagement. I think excellent points, excellent research, excellent questions. I think this was really productive and exciting, as always, to see this work in action. So I think we're just about right on time for a 5-minute break, and then I guess we return to our main room, leave the breakout room, but then take a 5-minute break.
Yep. And I just saw the reminder pop up at the top of the screen. So the breakout room will close. We'll all go back to the main room. We'll just have a slide there to remind us that there's a break and what time to come back. And then there'll be a short orientation to our next breakout sessions. Thank you so much to the presenters, to Carrie for facilitating, and for everyone who contributed to this excellent virtual poster presentation, rapid fire version.